Thank you, David. As it was said, I have a pleasure to moderate the second panel called Addressing Mental Health Crisis in Europe. And as you can imagine, this is, let's say, out of, well, maybe it's not the most fortunate word, but hot topic right now. And rightfully so. We have actually plenty of people invited to speak about the issue, since it's very complicated, complex, and needs policies that are complex to actually seek proper resolutions. So let me start with introducing our panelists. First of all, we will start with scene setting. And first to speak will be Tomáš Petříček, who is director of the Progressive Center and former Minister of Foreign Affairs in Czech Republic. Yeah, please welcome. Who has also many other affiliations, and during his work he also tackled the issues of social policy. So later we will hear more about Manifesto on Mental Health, among other things. Also with the scene setting will help Andrzej Kłoda, who is a mental health practitioner, psychiatrist, therapist, head of the mental health center based here in Cieszyn. Welcome. These two will be our first speakers. And then we will move to the discussion panel, and then I will introduce the rest of the panelists. So here you go, floor is yours.
Thank you. Good morning. First of all, I would like to thank you for the invitation. As to set the scene, I would like to highlight the fact that mental health has been present in European policy debate for more than 30 years. Actually, the first reference to mental health in the Council conclusions you can track back to 1996. Already in early 2000s we are speaking about there is no health without mental health. But true is, and as Monica mentioned, mental health has become a buzzword with COVID pandemic and with the current crisis we are facing, from war in Ukraine, inflation, energy crisis, and other crises that affect well-being and mental health of European population. In fact, the recent last autumn Eurobarometer shows that 82% of Europeans clearly link mental health with overall health. For 4/5 of Europeans, mental health is inseparable from health, their individual or community health. It is not surprising, therefore, that the European Union has reacted over the past couple of years to the mental health crisis. I think there is a general consensus that we are facing an increasing problem in this field. And the Commission, first of all, launched it as a priority. Ursula von der Leyen in 2022, for the first time, mentioned mental health in the State of the Union speech. And last June, the Commission presented a comprehensive approach to mental health, a communication that set a scene for new policy approach of the European Union to the area. However, I think that there is still a lot missing from the general picture, and for us progressives, it is clear that we need to push for more comprehensive and innovative mental health agenda in the next 5 years after the European elections. That leads me to the idea of Progressive Manifesto, and I would like to highlight 5 key issues. I think that for us there is still a little done on the issue of mental health in the workplace, mental health and well-being in the workplace, from issues like reporting on mental health. The companies should start reporting what they do for their employees in terms of well-being and mental health, tackling mental ill health from depressions, work-related stress factors, addictions, and so on. Second, it has been already mentioned, I think that there is a need to have a more innovative approach to mental health in digital era. Both in terms of how to tap the potential of new technologies in terms of assistance to people that are suffering with mental ill health, but also to address major challenges new technologies are bringing for our mental well-being. Let's be honest, there is a still underestimated impact of digital technologies, social networks, in relations to addictions, social isolation and social isolation-related depressions, and other serious mental health states. And we need to focus in particular on the most vulnerable here. Third, I would like to stress, and that's what we feel is missing from the overall picture, still a link between the problems of addictions and mental health. These comorbidities, issues related to how addictions worsen most of the mental ill health issues, and vice versa, how mental well-being, lack of mental well-being very often is one of the reasons for emergence of addictive behavior. So I think this is another area we need to focus much more. The fourth priority we see in area of reintegration after recovery. I haven't mentioned it so far, but there is still stigma associated with mental health issues, and especially in the most vulnerable groups. And first, it is an issue when it comes to treatment, or prevention and treatment, but even when it comes to reintegration of people who went through the treatment, recovered, and now they need help with integration back to the society. A lot of people still face a lot of barriers in terms of reintegration. And last but not least, and this is what I feel is a cross-cutting issue, is the question of addressing root causes of many mental health issues. And I think that's where progressives needs to be very vocal. And it is the issue of addressing the vulnerabilities, the relationship between marginalization and mental health, addressing socio-economic factors that play enormous role in emergence of mental ill health, issues such as, for example, housing related stress, the fact that for many young people the issue of housing creates a lot of stress, further contribute to their well-being, or rather lack of well-being, and it increases the potential of emergence of mental ill health. So this is something that goes through all priorities. We need to address and focus in particular on social groups that are facing marginalization, that are most vulnerable in relations to causes of mental health problems, be it at the workplace, be it in the digital area, be it in relations to addictions, and in terms of recovery. And last but not least, please allow me to conclude. It might be surprising that somebody who is focusing largely on geopolitics and foreign policies is also interested in mental health. But I would like to stress that that we should and we need also to always remember that there is a very strong link between mental health and well-being on the one hand, and the overall social resilience of European Union, our society, on the other hand. Especially in time of polycrisis we are facing, mental health and addressing issues related to mental health is a way how to strengthen European resilience to shocks, to crises we are facing and we will certainly be facing as well. So that's why I think it's also very much related to issues of security, safety and resilience. Thank you.
Thank you. Now let's pass the voice to Andrzej Kłoda. Floor is yours.
Ja bardzo się cieszę, że kolega Tomáš zaraz z zagranicy mówił przede mną, bo w naszym terenie, tutaj gdzie Państwo jesteście, w Cieszynie i w całym powiecie cieszyńskim, od samego początku pilotażu Centrum Zdrowia Psychicznego, działa Centrum Zdrowia Psychicznego obejmujące opieką wszystkich dorosłych mieszkańców tego terenu. Jest to program, który został wprowadzony dzięki uporowi ministra Balickiego, ale też wielu specjalistów z Polski, którzy zauważali, że opieka psychiatryczna skoncentrowana na dużych szpitalach, ewentualnie poradniach jest niewystarczająca. I po 5 latach naszej pracy i też obserwacji widzimy właśnie, jak bardzo skomplikowana jest ta opieka, ale też jak bardzo wpływa na właśnie dobrostan i jakość funkcjonowania naszych pacjentów. To, co ten program nam gwarantuje, to to, że my tutaj na miejscu wybieramy najlepsze formy dla naszych pacjentów. Czyli mamy budżet powierzony, mamy odpowiedzialność terytorialną i ci pacjenci w lepszy, zdecydowanie lepszy sposób są według mnie leczeni. W dalszym ciągu oczywiście brakuje nam szerszej współpracy i tutaj, jak wcześniej żeśmy słyszeli, taka współpraca na poziomie rządowym będzie miała miejsce, ale też myślę sobie, że to wypracowywanie współpracy na miejscu z samorządem, z pracodawcami, to żeby pacjent po leczeniu mógł wrócić do swojej pracy. Wiecie, ja zawsze miałem taki opór przed takimi zajęciami, że nasi pacjenci siedzieli wokół stołu i rysowali coś albo malowali. I to było fajne, takie zajęcia plastyczne, tak? Tylko że miałem tą zawsze świadomość, że jak kończą leczenie, to właściwie nie mają do czego wracać. Ja myślę sobie, że to jest istotne, żeby zbudować takie, to jest jeszcze przed nami oczywiście, zbudować takie formy współpracy, żeby pacjent, który jest leczony, mógł dalej kontynuować swoją rehabilitację, ale też z takim poczuciem, że jest użyteczny społecznie, że nie jest obciążeniem, ale jest użyteczny. Ja myślę sobie, że jakby tak patrząc się trochę historycznie, jesteśmy po takim przejściu właściwie 2, może nawet 3 rewolucji. Pierwsze to było przejście z naszego socjalizmu i to od razu w system wolnorynkowy i bardzo liberalny. Drugie to, o czym wspomniał mój przedmówca, czyli rewolucja technologiczna i to, że młodzież, ale my tak samo, przecież każdy z nas ma aparat telefoniczny, który jest aparatem fotograficznym, który jest dyktafonem, który przyjmuje maile. Właściwie przeszliśmy nagle do czegoś, co przez tysiące lat nam nie towarzyszyło. A my jesteśmy według mnie w dalszym ciągu zwierzętami, które potrzebują stada, które potrzebują dobrego rozumienia, bliskości, dotyku, a my komunikujemy się przez właśnie komórki. Czyli to jest kolejna rewolucja i kolejna to taka rewolucja kulturowa, którą my tutaj też zauważamy bardzo mocno będąc na granicy, że właściwie jesteśmy w Polsce, ale mam rodzinę w Czechach, ale wsiadam do pociągu, jadę do Pragi i do szwagra, a właściwie mój kolega pracuje po czeskiej stronie, a do mnie przyjeżdża lekarz, który mieszka w Czechach. Wszystko się zmniejszyło. Ale też się zmieniają się wartości i zmieniają się instytucje. Jak pomyślimy sobie, że Kościół przez 2000 lat był instytucją prawie nieruszalną, teraz obserwujemy dramatyczne schodzenie, według mnie, ze sceny, a na tą scenę wchodzi psychiatria. Takie mam wrażenie. Czyli w dalszym ciągu populacja potrzebuje rozumienia. Że jestem superwizorem, to trochę superwizuję zespołów i terapeutycznych i też psychoterapeutów Mam czasami takie nieodparte wrażenie, jakbym przyjeżdżał do różnych kościołów. Psychoterapeuci jedni zrzeszeni w takiej organizacji, drudzy w drugiej, mają innego biskupa, co innego głosi. Ja myślę sobie, że populacja w dalszym ciągu potrzebuje pewnego przewodnictwa. Ja wiem, że to może być trochę takie zbyt ostre, ale myślę sobie, że my nie różnimy się tak bardzo od naszych przodków, którzy żyli tutaj 200 lat temu albo 2000 lat temu. Mamy inne możliwości, inne gadżety. I chyba jest tak, że my tak samo potrzebujemy, i o tym chyba zapominamy w takiej erze technicyzacji, potrzebujemy bliskości, rozmowy, obecności i to jest ten kryzys, w którym jesteśmy. Kolejną kwestią jest to, że tak widzę, że trochę medycyna jest z rozpoznaniami, diagnozami jest trochę tak jak, znowu się odniosę do przykładu Kościoła, bo to są takie diagnozy, które wzbudzają lęk. Pamiętaj, że umrzesz. Nie? Memento mori, które było głoszone wcześniej przez filozofów, ale też Kościół się do tego też dobrze wpisywał. Medycyna to samo robi. Ja myślę sobie, że to, co jest niezwykle istotne, to w jaki sposób my powinniśmy komunikować ludziom wiele kwestii, ale zdrowotnych też, i to widzę tutaj też na takim moim małym podwórku, żeby nie wzbudzać lęku, dawać oparcie i towarzyszyć tym osobom. Ja też to tak widzę, patrząc się na ten slajd, gdzie tam widziałem, że jest rosnąca ilość osób pracujących w sektorze ochrony zdrowia, czy ogólnie szerszym nawet, i porównuję to z tym, ile było pracowników kilkanaście lat temu, 10 lat temu, i teraz jak mam grupę 160 współpracowników, którzy zajmują się pracą z pacjentami w Centrum Zdrowia, i myślę sobie, że to jest ciągle rosnące, bo właśnie jak być z drugim człowiekiem, jak mu komunikować, jak się nim zaopiekować, jak go poprowadzić z powrotem do takiego funkcjonowania w społeczeństwie. I tak mógłbym mówić dużo, ale zgadzam się jeszcze z tą jedną kwestią, jako że jesteśmy tutaj przy granicy i w Czechach jest trochę większe przyzwolenie chociażby na używanie marihuany, u nas w kraju nie, ale tutaj, także nie polecam tego tu, natomiast myślę sobie, że jest taka sytuacja właśnie poszukiwania młodych, szczególnie młodych nastolatków, młodych dorosłych, jak i wspomagaczy, które by pozwoliły im lepiej funkcjonować. Tak, oczywiście możemy mówić od razu o uzależnieniach, natomiast obserwując moich pacjentów jest trudno powiedzieć, czy są pacjenci tacy, którzy nie próbują znaleźć sobie swojej drogi właśnie używając różnych substancji, czy to stymulantów, czy uspokajaczy. Ja to rozumiem, że to jest jakby naturalny proces, natomiast on zdecydowanie bardzo mocno komplikuje opiekę w obszarze psychiatrii. No i to widzę tutaj na naszym podwórku. Chyba to tyle. Dziękuję.
Thank you both. I will kindly I will ask you to stay on the stage but sit on the side for the purpose on the well Q&A later, and also if you have Okay. And if you have later you know, during the discussion anything to add concerning, you know, all the answers of our panelists. It will be also nice to also to add something. So so thank you. For me, what you were saying was mostly about, if I can like very generally summarize, about the integration of the issues of mental health into everyday life, and also very basic human existential problems that we all encounter during forming relationships, during work. And basically this is something I would like to start the panel with. Before I introduce the rest of the guests, I will just say that we started with scene setting and short speeches. Now we are moving to the debate. and the end of this debate, we also shall have some time to have wider discussion. So whether any of you would like to have a question or comment or remark, there will also be time for that. And now I would like to welcome our three panelists. First is Natalia Kałuża. Welcome. Natalia is a board member of European Youth Forum, but also a human rights advocate and activist, and she will provide the perspective of the young people towards mental health today. Also, I would like to introduce Tomáš. Welcome. He is the head of Department of Psychiatry in Lazarski University, and also in the Wolski Mental Health Center in Warsaw, and also the president-elect of Polish Association of Community Psychiatry, and also mental health practitioner. Also we'll speak a lot about his professional experience. And also, last but not least, Sara Bojarczuk. Welcome. Sara is a sociologist by training and also research assistant professor in the Center of Migration Research at the University of Warsaw. And also writes a lot about mental health policies, so also will provide research expertise on the topic. So thank you all for coming. I am looking forward to this discussion. As we started to talk about the integration of mental health issues. This is something that actually I would like to start with, because when I recall the times, let's say a decade ago, or at least even less, I would say that if this panel happened then, we would discuss more about how to make the topic less stigmatized and how to help people understand that, for example, their struggles are real, that they have right to seek help. And nowadays, I think that maybe I wouldn't say that it's not a problem anymore, but awareness rose for sure. And more people are vocal about the existence of the topic. Also politicians, celebrities, journalists, as well as personally, but also as a general topic, they address it publicly. So more and more people are encouraged to think about their lives in terms of addressing the mental health issues. In this context, let's say the growing visibility of the problem, and especially after the COVID pandemic experience, would you say that we as a public in Europe, in general, are we in better or worse condition, and why is so?
Thank you. And thank you for the question. I think in general, there's more discussion around mental health for sure. There's new roadmaps and set aims, like the Commission's comprehensive approach towards the mental health. But in general, still half of all the young Europeans now report still a poor mental health. And depression and anxiety has doubled in most of the European countries, throughout these 5 years. Since 2002, there has been some improvement in the mental health in general, but still the young people are reporting the doubled amount of depression and also reporting higher amount of mental health problems comparing to the older generations, for example. So in the data that we gathered in the European Youth Capital, in the Youth Forum, we had this Beyond Lockdown report, we gathered the data that 1 in 2 young people are now still reporting unmet needs when it comes to mental health support and mental health services, 1 in 2 in Europe, which makes us a half of the population of young people. So I would say that it's still definitely an issue, and all the statistics are aligned on it. I would say it's a growing issue still, and we are not yet being able to really go into the roots of the problem. We are still really linking the mental health and issue only within the health policies or within the topics related to caring or nursing. We're not seeing it as a political and economic issue as it is. And really, when we're going to the roots, mental health, it's not an individual problem, as we're still a lot of seeing it that way. It's a political and economical issue, and it has the roots in the austerity measures, in the financial crisis, in the aftermath of the COVID-19 pandemic. It has the roots in the precarious working conditions, such as platform work or unpaid internships. When I'm now having the youth perspective when I'm talking. And it's really interrelated with the social aspects, such as financial instability, platform work, loneliness, isolation, housing, and so on. And when we look at it in the deeper level as well, I think we really should be focusing, like it was also said in the scene setting, the how do we see and value work in general in our society. Because I think that the deepest roots of the mental health crisis are in the culture and how the culture is valuing and seeing the work. Because how is it that the most valuable works that we have in the society, such as caring or taking the rubbish out or food delivery, are the works where where young people and people in general are in the most precarious working conditions. And work, of course, it should be something that you can, by that you can afford and sustainable living conditions, such as housing, and afford and sustainable and affordable living in general.
Thank you.
Oh, thank you. Thank you for inviting. And to answer this, maybe I would like to share my perspective as a doctor, because it's almost 30 years I'm working in psychiatry. And of course I agree that it's difficult to say that we solved the problem or that we are in a better condition looking for the mental health problems of the society. But I also feel, unfortunately, kind of déjà vu during panels like this and conferences like this, speaking about the same things over these 30 years and saying a little bit it's like double bookkeeping, that we are talking about, yes, mental health issues are very important. There is no health without mental health. Mental health people are vulnerable and we are leaving them behind. We must do something for them. And then nothing happens, or maybe not nothing, but too little happens. And I also feel that we have kind of waves of interest. Now, thank to COVID and thank to really big problems we had during the pandemic, we started again to think about mental health and to see that's really world problem, European problem of every society. And I hope that it will generate more changes, because somehow these changes need these pushes. And but I also know that it might be that we have not very wide time gap to initiate these changes, that maybe it's this year, and for European Union or changing the policy or making any kind of new policy, soon it won't be a first issue or first pages and so on. Well, it's important that we are here, and it's important to talk about it. But also, I believe that somehow it's important to act on the level of European Union, but also we must remember that mental health is part of, it's just a human right. And if it is a human right, it is an obligation of the state, is obligation of the government for to act for mental health. And we don't need, in fact, a new treaty, European regulations. We just need them our governments to start to do their work. And we need them to ask them, why are you not doing this? It took 25 years in Poland to start with mental health reform, or even more. But when I started my work as a psychiatrist, it was just a discussion how much we need the mental health, change the organization of our mental health system, and that we must do it now. I remember that when I started my specialization in psychiatry, there was signs of big crisis in child and adolescent psychiatry. It was 25 years ago. We were talking about that we have two less doctors, that this specialization need more prioritization, but not only the specialization, that there are just wide gaps on the Poland map where you have no access for specialists in mental health for child and adolescent, for adults too. But somehow it was possible not to see the problem for many years. So what was the crisis became really a big crisis, and thanks God it started the reform we have, which is just halfway. So a lot of things to do. And Andrzej just said that thanks to somehow the moment in Polish politics when it was possible to introduce this mental health reform. It was started also here, and that we see that this reform, which follows the rules of community psychiatry, understood as the level of organization of psychiatric care, and this way of organization of psychiatric care which somehow give really opportunity for the certain population, because this kind of organization depends on giving the mental health care for a certain defined population. And it gives opportunity for those people to have good access to service in terms of distance, but also in terms of quality, in terms of, I don't know, 1 hour drive. Is it possible 1 hour drive here in Cieszyn? Okay, but almost possible. Anyway, it's also, it's thinking in terms of population. It's thinking and organizing this mental health care in terms of thinking of public health, and it gives this opportunity to get all kinds of psychiatric help we have in psychiatry, and also it, of course, it's in Poland. It means that you will get this help for free, that you have guarantee that you don't pay for this mental health care. So I think it's, of course, it's not ideal solutions, but it's good solution. It's good solution to be promoted more in Poland, but we now see that we really need a lot of work to make it happen all over Poland, and that we also, in the same time, we have different views, and that we have also some people thinking that, well, maybe we will have better solution, or at least a solution which is cheaper and which will be more efficient in terms of paying less for psychiatry. I'm joking a little bit, but somehow it's the idea behind some critics. And we really need a lot of help, and we really need a lot of real interest in psychiatry and real understanding in psychiatry to make these changes, because only through these changes we can dream about changing this situation we have now, and the answer for the question whether we are in better or worse condition than 5 years ago or 20 years ago. I don't know. And but at the end, to finish, one thing that Andrzej also somehow describing what happened to church, said that, okay, sometimes psychiatry comes to this void space left by not only church, but sometimes traditional family and other organizations in the societies. And I think that it's not necessary that we really want to be there. It's not necessary that psychiatry and psychologists, psychotherapy, that we want to be put at this place, at this role. And what is going on, that in the same time we have, of course, big problems, issues around mental health, but also we have a tendency, and we can observe a tendency to medicalize and psychiatrize many things which are going in society, in our families, in everyday problems. And we are, one of my friends is joking that sometimes we are like, you know, these mechanics. You are just coming with your car and you are leaving it and saying, well, make it be good car again. And I don't care what you will do with it, but it's your problem, it's not our problem. I'm just leaving you this car and you have 5 days and I will come and maybe I will pay you. And of course, it's completely different story, but we even don't think sometimes when there is a problem with a child in a school, or we have a problem with our workplace, and we are calling it depression, and we are calling it Asperger's syndrome. No more this name valid, but it's in the air, and we are addressing it to psychiatry to solve it. And of course, that if we are making this kind of demand towards psychiatrists, it's really impossible. We might be 10,000 psychiatrists in Poland and more psychotherapists, but in this way of addressing different problems which are psychiatry, no, they are not psychiatry. We cannot manage them to solve them. Okay, I think it's enough.
Thank you. Sarah?
Yeah. Go on. I'm actually very happy that I came in last in this round, because my points are quite sort of summarizing what you said. So 25 years after talking about reform in Poland and about the crisis that we've had, we still do have crisis. We still have crisis in terms of number of staff. Whether we are better or worse, it's difficult to say, but for sure we have different tools to talk about. We are more aware what we talk about, but if it's better, if it's solved, I don't think so. And it comes from, first of all, staff. One of the research project that I'm participating in is we researched the plans for young medical students, how likely they are to leave Poland. And among one of the questions, putting aside their plans to leave, among one of the questions we ask is what are their chosen specialization that they want to pursue. 7%, and we survey all 6-year students with all the universities. 7% want to choose psychiatry, and the rest go for more sort of hot and sort of syllable professions. Slowly, but it it is comparing. This was the second round. The first round was much smaller. It was, I think, 5. It's 2% growing, but we'll see. We're now collecting another round. But I think it's also, when we talk about awareness and when we talk about crisis, we do need fundamental reform in the language that we use. And just to note, so far in our discussion, I've noted, when we talk about mental health, I've noted terms that we here have used: patients, treatment, rehabilitation, diagnosis, fear, support, company, which all indicate victimization of people who do need empowerment to deal with their own issues that they face in life. And going directly towards psychiatry is way too much, and this is over-medicalization, over-diagnosing. And even if you go to the pharmacy in Poland, you can just spend all the money you have and come out with 3 bags of pills for you name it. But the change starts in us and the kind of words that we use.
Thank you. Thank you for your remarks. I would say that we are in the moment of the debate that we said what was needed to be said, but also what we all recognize as true. When it comes, for example, to the context of the mental struggle, that we are all overburdened in the way that actually needs complex addressing, and also psychiatry as a new church is overburdened with this task, that we cannot limit ourselves with medicalization. And of course I agree, but if we consider all the topics that we tackled, and also on the previous panel, that, for example, we need to think about work, we need to think about education, we need to think about creating meeting spaces for people, we need to reintegrate former patients, we need to think about how we organize workplace, how long do we work, how are, for example, the norms of children upbringing, and so on and so on and so on. We can see that this monster of problems is only growing, and still we need to tackle this practically, politically. So my next question is exactly like this: okay, we can say that medicalization is not enough, that we also need to think about how we speak about the problem, but after all, we need to think who is going to address this and how. Who we should hold responsible for bringing solutions, if, for example, not the psychiatrist or not simply one ministry. How would you see, the political approach here to appropriately address this question? And maybe we can start from Sarah to Natalia.
So I think my co-speaker, Mr. Szafrański, will support me a lot in that, and I think this is community. And starting from as I already said, empowering people and being able to allow them to function and assist them in their natural environment, or in the environment that they function, that will enable them to make decisions and make the choices that they are able to, where they're able to function properly, rather than, as we said, locking people away and then having a struggle to reintegrate them into society, which brings up yet another issue. I do have, actually, I don't usually bring my laptop with me for the talk, but I do have a really nice data. Sorry for not being able to remember that all, but this is the data from NFZ from between January and June from 2022.
National Health Service in Poland.
Yes, I'm happy to share that as well. But it did talk about the use of Ukrainian migrants or Ukrainian refugees who who came to Poland, in terms of different mental health services that they've used. Most of them were were kind of the sort of issues related to stress, the PTSD, stress disorder, and all the somatic stress issues. But these were relatively sort of light diagnosis in terms of the sort of scale, the scale that the NFZ operates, but majority of them were treated either in ambulatory care or full-time care, like 24 hours care, which means these people were straight of all institutionalized. So imagine those people who came from the setting that they came, and first of all, they end up in institutions in Poland that, let's face it, they're not very people-friendly. And they're also, on top of that, we do talk also about difference in cultural competencies, where Polish practitioners, in majority, not all of them, did not have skills, were not aware, because why would they? They were not prepared. One of the solutions that could have been then introduced is simply the groups or the sort of support groups that many NGOs have done at this time. So even if it was just a simple, I don't know, drawing, knitting, whatever, this was something that allowed those people to open up. And then all of a sudden it turned out that those women don't sleep at night, that they hide their sons and children because they don't want them to go to Ukraine, and that they actually cannot focus, cannot function properly. And yet those few minutes of talking was much more productive and was much more powerful for them than any other medication that they could give. So back to your question, I do believe is the community-based support. And we've already mentioned Mr. Balicki's attempts to reform, but I'm very much in favor of that. I do cooperate with the hospitals in Krakow. And I would believe that this is definitely the way to continue.
Okay. Maybe a short comment about this situation with after Russian aggression on Ukraine started. And from the point of view of mental health centers, we were just when it happened, we expected just a tsunami or a wave of people coming from help. And we are Wola Mental Health Center, so we have Warszawa Zachodnia railway station near to our place, and with a big, that time with a big place for receiving these people coming. So we organized translators, we organized, well, we were prepared for additional time and additional space to accommodate these people, and of course we talked to psychologists who is speaking Russian, who still remember Russian at school. Older people remember a little bit, younger not. Anyway, nothing happened. Of course, we had some patients, but it was really, and those data from National Fund, we asked them as a Polish Psychiatric Association at one moment, and it was really in a situation when the Polish government gave those people from Ukraine full access to mental health without payment. So there are different explanations, but colleagues from Ukraine told us, among others, that in Ukraine you don't have, this culture or this thinking that you are looking for psychiatric help even if you are in a bad condition. And about those institutionalized patients, of course, most of them were just patients with severe mental illness who came to Poland. So they really, this was not, kind of overacting, hospitalizing all, and not all of them. At least I think part of them were just in a hospital because they really needed this treatment. Anyway, coming back to the question, who is responsible? My opinion is that first of all we must ask for good policy, state policy and political decisions, because without these political decisions we will have nothing. And we hope that now we are in this fortunate somehow moment when it will be possible to improve what's going on in child and adolescent psychiatry in Poland, and this cooperation of different ministries will also give this reform possibility to be really based on schools and on real contact with the population of child and adolescents, and that it won't be only the psychiatric issue. And the other decision we are waiting is the decision to really make the progress in this reform of adult psychiatry. We still don't know what will happen. We have this program which started now. It will be 5 years ago. It was supposed to end after 3 years. It was extended because of COVID, then it was extended because of the war, and now it will be extended because through all this time it was not possible for the past government to prepare our legislation and needed things to really make this program happen in the whole Poland. So we hear that, okay, we will have again 1 year of this pilot program which is now for the half population of Poland, but without organizational standards, without just giving people who are creating these new mental health centers indicators, advice, what they should do. When we started with Andrzej this 5 years ago, it was, I think, 33 centers started. Usually we were well prepared. We were psychiatrists who knew about community psychiatry and who were somehow enthusiastic. And we had at least teams with several people who were involved, and it was possible to start easily. And now sometimes this is going on in the places where really they don't know what is this community psychiatry, and it's not so easy because it needs changing in thinking. It's coming from individual work to the teamwork. It's about cooperation, it's about networking, it's about making this cooperation with social care, with primary care doctors, with looking for work and helping people to really participate in community, to establish some kind of cooperation with NGOs, many things which true psychiatrists think are useless or are not my work. But also this kind of change is change which for some psychiatrists is dangerous, because I'm not, Andrzej is still the most important person here in Cieszyn, and I think that I'm still important, but in many teams we became not so much important, and I think it was very, very important thing about this different, that we need these teams which are not based only on doctor expertise, on psychologist expertise, that we need to engage many, many, many other people who can help in mental health problems. Anyway, it's a process, and this responsibility and this part of responsibility is on us, on mental health workers, but part of it is also on these local governments. Part of it is on this local administration, and part of it is of course on local communities, and I'm quite pessimist about it, because still in Poland we have a lot of stigma, and we can say that probably all over Europe we have a lot of stigma, and we have a lot of anti-stigma programs which, in my opinion, do nothing except making those people who are making these programs happy and thinking that they are but we have some research in Poland showing that during last 30 years about stigma there is not a big change, and somehow it's very good that we are talking more about it, that we have people, celebrities, saying, publishing books about their being bipolar or being depressed and so on and so on. And of course it was really almost maybe impossible 30 years ago in this country, and now it's quite possible, and but still it's not, it doesn't mean that we have big change. Sorry, I'm talking too much. I'm psychiatrist.
No, but thank you. And I think both of you very well highlighted like the importance of the language and the communication around mental health, which I think, and like the translation of the language that we use regarding mental health. Mental health is a collective problem, and the solutions to it, and to find the solution to overcome it, we need everybody on the board. We need all the generations to be on like around the table. We need all the groups presented to the table to have the intersectional lens in order to understand what is missing, what are the needs. And when it comes to policy, like the European Youth Forum has been long-standing advocating for an EU youth test, which is the bridge, kind of like to build the bridge between the gap between policy and the young people's experiences. In simple terms, the EU test sets out a framework for evaluating the impact that any new proposal may have on young people in the EU level. And we were very happy that the European Commission actually recently this year implemented the EU youth test, but now it's called EU youth check, marking a milestone for us in the European Youth Forum that now young people will be part of the processes, not only when it comes to, for example, policies regarding young people in general, but in all the policies, like what kind of affection they might have in the lives of young people. And of course, the national authorities play a big role when it comes to overcoming problems regarding mental health. National authorities are in a big role when we think about how do we create the social welfare system that works for young people, that works for everyone. How do we end the back-to-back temporary contracts? How do we have universal workers' rights? How do we build awareness regarding workplace rights? How do young people know what their rights are? That is something that the national authorities have a big role in playing. And also, national authorities have a role on how do we shift from the idea of having a minimum wage to how do we have a living wage. There's a big difference between those two terms, and I think the national authorities play a big role in that, and those have a huge impact on the mental health of young people and mental health of everyone as well, of course. And of course, when we think about the solutions as well, we need the EU and the international community be on the board as well, like putting the resources on the already existing roadmaps and aims and settings and goals that they already have already regarding the mental health. But in the short, I think it's just everybody needs to be in the board, and that's the only way how we can find solution. Mental health is a collective problem that is affecting everybody in the society in a different ways, but it is still. And to understand what is missing and what needs to be done is that we need to hear the lived realities of everyone impacted in the society.
I think it's a nice wrap-up for the debate. So thank you all for the participation. Maybe we have some time for at least one or two questions, or commentary, if anyone from the audience would like to add something or ask maybe a question to anyone from... Yeah? Come on, Mateusz.
Just a quick question / comment, so we don't feel that we agree too much, because we need to be self-critical. And I would say one of the major dangers for the EU is when the EU, we've been talking with former commissioner on that, is framed as something putting regulations from above that destroy communities and people ways of life. And the concept of therapeutic state, which was not created by some crazy right-wingers, but by Christopher Lasch, for example, is something we should be very careful of. And I think that's why community is really important. Vice Minister Piękna Więckiewicz is not here at the moment, but I think what she said about the school is extremely important. And because it's an existing institution in small communities. I used to be, in a village, small school, cultural center, political center to a certain extent. So this is something very different, very bottom-up, not top-down, and I would also say not excluding existing communities that don't fit very easily into progressive framework. I was able to come quite well, I think, at least through the first wave of the pandemics, because I have a close, supportive, Protestant, charismatic Christian community, which was supporting me. So I would just be very attentive to the dangers of EU policies, as we saw with many stuff, don't want to get into the agricultural stuff, but getting involved people who are not usual suspects in supporting the kind of social democratic talk on board. I think this is really essential for the cohesion or even the very existence of the EU. Thank you.
Okay, Sarah, one last remark and
I
then
think
wrap up.
To support you in that, one of the main conclusions from the FEPS report and FEPS study that we were doing was, one of the question was how European Union or what role can European Union play in improving mental health, and one of the main recommendation was to support communities and funding for communities.
Yeah, thank you.
Thank you.
Thank you for this input. I also believe it's important that we maybe transform, especially on the basis of this issue of mental health crisis, from being subject to being agents of political change. And of course it can, merge into various forms. And on practical level, we still need, discussions and implementations. But for now, unfortunately, we need to finish this part of the program. So thank you all. And I hope that you enjoyed the participation in this discussion. And, well, good health to all. Thank you. So